Good afternoon, everybody. My topic today is basics of lactation. So I would like to start this topic with this quote by Sushrita. Where he compares mother's milk with nectar, just like how nectar makes the gods immortal. Mother's milk has similar effects on the baby. So a newborn has only 3 demands, that is warmth in mother's arms, food from her, and security in the knowledge of her presence. And breastfeeding satisfies all the 3. So let us discuss about the benefits of breast milk to a baby. Mother's milk protects a baby from ear infections, diarrheas, URTIs and LRTIs, pneumonias, obesity, childhood cancers, diabetes, lymphomas, dental caries. It promotes better brain growth and mental development, and it also protects from asthma, eczema, and allergies. By reducing the majority of childhood infections, hospitalization reduces by almost 50%. Exclusive breastfeeding for 3 or 6 months helps from protection from ear infections by 50%, upper and lower respiratory tract infections by 60 to 70%, and any amount of breast milk protects from GE by 64%, obesity by 25%, type 1 and type 2 diabetes by 30 to 40%, AMLs and ALLs by 15 to 20%, and SIDS by 36%. Also, preterm infants who are given just exclusive human milk, NEC is reduced by 77%. What are the benefits of breastfeeding to a mother? So breastfeeding protects mothers from breast cancers, ovarian cancer, postpartum bleeding, depression, hypertension, hyperlipidemias, cardiovascular diseases, type 2 diabetes, osteoporosis, promotes faster and healthier weight loss. It decreases workload, saves time and energy. And also, mothers who exclusively breastfeed also have lactation amenorrhea, which acts as a contraceptive and prevents further pregnancies. So when we compare breast milk with formula, breast milk is the gold standard of nutrition. It is a naturally available special food for premature babies. It is provided at right temperature. It is clean with no contamination. It is readily available, environment friendly, and also has low cost. WHO recommends early breastfeeding, that is initiation of breastfeeding within the first 30 minutes of life in case of normal deliveries and at least within 1 hour of life in elective cesarean sections. Also, exclusive breastfeeding and should be given till 6 months, and no other pre-lactal foods or outside milk, animal milk, honey, etc. should not be given. Complementary diet should be started at 6 months, and expanded breastfeeding should be provided till 2 years. But still, according to the NFHS Survey 5, early initiation of breastfeeding rates are at 40%, and exclusive direct breastfeeding rates at 6 months are just 60%. So now let us start with the anatomy of breast. Breast is a modified sweat gland. It contains adipose tissue and glandular tissue. The glandular tissue is made up of the units of the glandular tissue are acini or alveoli, which produce the milk. They are surrounded by the epithelial cells. The epithelial cells are surrounded by the myoepithelial cells, contraction of which ejects the milk into the ductular system. The ductular system opens into the lactiferous sinus, and that opens into the nipple, which are the passages of the milk. In the pregnancy, the size of the breast gland increases, the areola pigmentation increases, and the activity of glands in the areola called Montgomery glands also increases. Montgomery glands helps in lubrication of the areola, and it also has anti-infective properties. Hence, it is important for mothers not to repeatedly wash the breast with soap and water and just clean with water, so that the activity of Montgomery glands does not reduce and the predisposition to fungal infection reduces. So the upper part of the diagram is showing the non-lactating breast, and the lower part of the diagram is showing the lactating breast. As we can see, the glandular tissue is much more developed in the lower part of the diagram. So there are also this blue part is showing the suspensory ligaments of the Cooper, which gives the support to the breast with the chest wall. Now let us discuss about the physiology of lactation. So when the baby suckles on the nipple, it stimulates the sensory nerve impulses in the areola, which is carried to the brain. The neurosecretory cells of the supraoptic nucleus are stimulated, and from the hypothalamus and the posterior pituitary, the oxytocin is released. Oxytocin is going to go into the breast tissue. It stimulates the myoepithelial cells and it squeezes the milk from the alveoli into the lactiferous ducts. So what are the hormones of pregnancy and lactation? The hormones of pregnancy are progesterone, estrogen, human placental lactogen, all of which helps in promotion of the breast tissue. They prevent the ovulation, they prevent the secretion of milk, and also they prevent the future pregnancies. Once the baby is delivered, the placenta comes out. So the amount of the hormones, the progesterone, the estrogen comes down. With the fall in the hormones over the first 3 to 4 days post-pregnancy, the prolactin levels increases. And oxytocin is also secreted in a pulsatile fashion. So the hormones of lactation are prolactin and oxytocin. So as we have just discussed in the first 16 weeks, from 16 weeks of pregnancy to 3 to 4 days of life, the milk production is under the endocrine or hormonal control. And post-delivery, it is mainly under autocrine or local control. So once the baby suckles and drinks milk, prolactin is secreted after the feed to produce the next feed. So the production of prolactin is more during the night time, and hence it is important to advise the parents regarding night feeding. And prolactin also suppresses ovulation and prevents further pregnancies. So the milk reflex by prolactin is enhanced by emptying of breast, by sucking of baby, by expression of milk, and by night feeds, whereas the hindering factors are the bottle feeds, improper latch, and painful breast conditions. So prolactin secretion is enhanced by how early we start with, that is early initiation of breastfeeding, the frequency of breastfeeds, the duration of breastfeeds, and the proper latch or attachment. And it is hindered by delayed initiation of feeds, prelactal feeds, making the baby wait for feeds, that is longer duration between the feeds, using of dummies, pacifiers, bottles, and certain medications given to mothers, and painful breast conditions. So as we discussed, suckling causes the stimulation of mechanoreceptors in the nipple, and from the hypothalamus, from the posterior pituitary, oxytocin is released, which causes the milk ejection, and from the anterior pituitary, prolactin is released, which causes the milk secretion. So oxytocin reflex is stimulated by thinking of the baby, sound of baby, sight of baby, touch of baby, and mother being confident regarding the breastfeeding journey. And it is inhibited by worry of the baby, stress, pain, and other doubtful conditions. And there are again certain reflexes in the baby which cause the baby to how to learn breastfeeding and how to swallow the milk. So the first important reflex is rooting reflex. When we touch the corner of the mouth with the nipple, baby turns towards the side of the nipple and opens the mouth and rolls the tongue forward. This is the rooting reflex which develops around 28 weeks. The sucking reflex is elicited when anything touches on the upper palate. So baby tries to suck it. And this develops around 32 weeks. Swallowing reflex develops in the womb around 12 weeks itself. And baby tries to swallow whatever enters the mouth. Now let us discuss about the stages of lactation. There are 4 stages of lactation. The first stage is also known as the lactogenesis 1. Here there is secretory differentiation. It starts around mid-pregnancy, that is around 16 to 20 weeks. And secretion of milk at this stage is prevented by progesterone and estrogen. The second stage is secretory activation, that is lactogenesis 2. It starts from day 3 to day 8 of postpartum. It lasts between the day 3 to day 8. This is characterized by onset of copious milk production. So the level of progesterone decreases during the first 4 days, and this causes programmed transformation of mammary epithelium. So the amount of milk production at this time can be around 500 to 750 ml per day on day 5 itself. And the next stage is the lactogenesis 3 stage, that is galactopoiesis. This is from day 9 to involution. Here there is maintenance of established milk supply, It is under autocrine and local control. And the last stage is involution, which happens 40 days after the last breastfeed. So the milk produced in the first 1 to 4 days of life is called as the colostrum, which is also appropriately known as the first vaccine. It has many nutritional factors, immune factors, and growth factors. It contains energy, protein, vitamins, minerals, and fats required for a baby during the first 2 days. The immune factors include cytokines, antimicrobial peptides, lactoferrin, lactalbumin, lysozymes, and also immunoglobulins IgG, IgA, and IgM, all of which protect from infections. And there are certain growth factors like epidermal growth factor, transforming growth factor, insulin-like growth factor, growth hormones, PDGF, vascular epithelial growth factor, all of which help in the development of skin, help in the growth, help in the development of vessels, and GIT. So breast milk also contains many microbial communities like Staphylococcus, Streptococcus, Lactobacillus, and Propionibacterium, which help in the development of healthy microbiota in the baby. And there are again certain microRNAs which help in constructing the infant's immune system through the intestine. Colostrum, the liquid gold, has high level of proteins, low sugars, and low fats. It also acts as a laxative and helps in passage of colostrum and hence decreases the risk of jaundice. It has many immune factors as we just discussed, and it is also rich in vitamin A. The volume of colostrum is very less, and that is the reason most of the mothers would not be able to express the colostrum when they try to express the breast. It is only secreted in the quantity of 5 to 25 ml, but this helps in the baby for the baby to regulate the suck, swallow, and breathing cycle during the initial few days. Then how is the glucose level maintained during the initial few days is by glycogenolysis and gluconeogenesis. So how does mother's milk protect from infections? So whenever a mother is infected, we should compulsorily advise to continue breastfeeding during this time because the WBC produced in the mother protects, makes antibodies, and some of these WBC also go into the breast and cause local production of antibodies. These antibodies are secreted into the milk and helps in protecting the babies from the infections. Then there are certain different factors which are present in the breast milk which are not present elsewhere. One of them is Hamlet, which stands for human alpha lactalbumin made lethal to tumor cells. So it has apoptotic properties or tumoricidal properties. It's a protein lipid complex with effects on glioblastoma, bladder cancer, and intestinal cancer. It has also been shown to target skin papillomas and bladder cancers. The other most important thing which a breast milk contains is human milk oligosaccharides, which are indigestible carbohydrates. So they have anti-infective properties against the many gastrointestinal pathogens like Salmonella, Listeria, Campylobacter. They also play a major role in growth and development. And it also has virucidal properties and anti-adhesive properties by which it helps us from viral infections. So how does the breast milk composition vary? So colostrum, as we discussed, contains high level of proteins and it has little lower levels of fats and sugars. And fore milk contains more of lactose and high quantity of water and thus satisfy the baby's thirst immediately after feeding. The hind milk contains a lot of fats and it helps the baby's weight gain, and it also helps in sustaining a baby for at least 2 to 3 hours post-feed, helps in increasing the satiety. So the stages of breast milk are the colostrum, which is produced right from pregnancy to the first 2 to 5 days after birth, transitional milk from 2 days to 2 weeks of life, and mature milk, which lasts later. So the colostrum is deep yellow, thick and sticky, and contains high fats and fat-soluble vitamins, minerals, and antibodies. Transitional milk, which present in the first 2 weeks, is thinner, and it is high in fat, lactose, and water-soluble vitamins. It is a good source of calories. The mature milk, which is present after 2 weeks, is more of watery and less concentrated, and it contains almost 90% of water for hydration, and it contains optimal quantities of carbohydrates, fats, and proteins required by a baby. When we compare preterm milk and full-term milk, preterm milk contains higher quantity of proteins required for a premature baby when compared to the term milk. So what are the advantages of breast milk in a premature baby? It reduces NEC, all forms of severe NEC by 17%, late onset sepsis by 19%, bronchopulmonary dysplasia by 43%, any form of ROP by 50 to 70%. By reducing all this, it also reduces the days of hospitalization by 50%, reduces the cost of hospitalization, risk of rehospitalization, and it also increases the IQ points by 5 points. So does preterm breast milk meet the requirements required by a premature baby? So the calorie requirement, fat requirement, and carbohydrate requirement are met, but the protein requirement is much less in a premature baby. Like a preterm baby requires usually 3.5 to 4 grams per day, but breast milk provides us only 2.5 grams. There's a deficit of 1 gram, which is met by adding the human milk fortifiers. And when we compare the micronutrients and macronutrients, most of them are deficient. Most importantly, calcium, phosphorus, iron. So all of these are again met by adding the human milk fortifiers. And when we discuss about the type of initiation of breastfeed, so any baby who is more than 34 weeks can be immediately started on breastfeeding. The adequacy can be checked, and if there is any problem, we can initiate spoon feeds along with the breastfeeds. Babies between 22 to 44 weeks should be predominantly fed by breastfeeding, also supplemented with spoon feeds. And babies between 29 to 31 weeks, the major form of feeding is usually by gavage feeding. So how do we get successful breastfeeding? We need a mother who is motivated and willing to breastfeed, a newborn who is active, healthy, and sucking well. And also we need a motivator who can help the mother and the baby in their breastfeeding journey. So let us discuss about the BFHI 10 steps to successful breastfeeding. Every hospital should have a written policy regarding the breastfeeding, and they shouldn't support any formula feeds. And staff need to be, staff competency need to be promoted by regular training of the staff involved. There should be antenatal education classes, and breastfeeding mothers in every visit needs to be, pregnant mothers in every visit needs to be discussed on educated about the breastfeeding. And after birth, immediately early skin to skin contact should be promoted, and early initiation of breastfeeding needs to be started. And throughout the hospitalization, mother needs to be supported at every visit and every breastfeeding regarding the breastfeeding. And if the baby is not able to breastfeed well, supplementary formula feeds need to be provided under complete aseptic precautions. And mothers, also parents, need to be educated regarding the initiation of formula feeds in a sterile manner. And mother and baby need to be roomed in almost 24 hours every day, which helps in sustaining the breastfeeding. And responsive feeding needs to be taught, that is identifying the early cues and feeding when as and when needed. Bottles, teats, and pacifiers should not be promoted. And even after discharge on every postnatal visit, again, mother needs to be educated and feeding needs to be checked. So to ensure the successful breastfeeding, the first most important thing is initiation of breastfeeding in the golden hour, that is first 1 hour after life of a baby. So there are certain, when we try to start breast crawl in these babies, when we try to attach the baby to the mother's chest immediately after delivery, there are certain movements which happen in a baby. First, baby tries to do certain hand to mouth movements, then tongue movements, tries to open mouth, focuses on the nipple, crawls to the nipple, massages the breast to avoid the nipple, and then starts licking and attaching to the breast. So this picture beautifully shows the steps of a breast crawl. First, the baby is crying, then baby tries to relax a little, then baby awakens, shows some activity, again rests for a while, then starts identifying the mother, tries to crawl to the mother, then starts getting familiarized with the breast, tries to avoid the nipple and suckles, and then sleeps. So what are the benefits of early initiation of breastfeeding within the first 1 hour of life? It promotes bonding between the baby and mother, reduces maternal stress, it helps in uterine contraction and reduces PPH. It also increases the milk production, it helps in early meconium passage and thereby reduces jaundice, and it regulates the temperature and stabilizes sugar levels. So how often should we breastfeed? So we need to remember that if a baby is healthy term baby, baby can be the boss. We shouldn't go by clock. And sometimes immediately after birth, baby can become a little stressful and sleep because of the stressful birth process. So we need to feed whenever baby asks. Frequent feeding helps in increasing the milk production. And in the initial few days, at least 8 to 10 feeds should be given per day. And how do we identify when the baby is hungry? So it is important to identify early cues and feed the baby when baby is showing the initial signs of hunger, like stirring, mouth opening, turning head, doing rooting reflex. And when baby is showing mid cues like stretching, increasing physical movements, then baby is like really hungry. When baby starts crying and agitated and color is becoming red, that is the time when breastfeeding is going to be difficult. A crying baby does not like to breastfeed, and hence it is important to calm the baby before trying direct breastfeeding by cuddling the baby, doing skin to skin contact, talking with the baby and stroking the baby, and then try to breastfeed. So in the initial 2 days, colostrum is produced, and from day 3, usually the supply increases. This is known as the coming in of milk when the breast feels fuller, and if milk is not correctly expressed at this stage, usually there is engorgement. And during this phase also, when baby is sucking from one side, there is leak from the other breast, which indicates that the milk production is adequate. So from day 5, the more you nurse, the more is the milk production. So it's a myth that the breast size determines milk production. Only the amount of emptying. The more you empty, the more is the milk production. Once you empty, the hormones, prolactin is released, milk is produced. And once baby suckles and empties, again this cycle goes on. So if you do not empty frequently, if there is stagnation of milk in the breast, there's a protein in the milk called the feedback inhibitor of lactation, which increases. So when this increases, it decreases the milk production. So frequent emptying decreases the FIL. So this is a frequently feeding breast where the FIL concentration is less. And here the milk is not ejected properly. Mother is not feeding well. The FIL concentration is increasing, which causes the less and less milk production. Now let's discuss about the positioning, proper positioning. So baby should be at the level of the breast. The whole of the baby's head, neck, and body needs to be supported. It should be in a straight line. And the entire baby should be turned towards the mother. So tummy of the baby should be touching the tummy of the mother. These are the basics of positioning. And what are the basics of correct latching? So whenever a baby is attached well, usually the mouth of the baby is wide open, the chin is touching the lower part of the breast, the lower lip is curled outwards, and the entire nipple and areola is inside the baby's mouth. So this picture again shows the correct latch where the nose is close to the breast, chin is touching the lower part of breast, and the nipple and areola are inside the baby's mouth. So when we compare this with this picture, here the latch is poor. The angle between the mouth is narrow. Much of the areola and nipple are visible outside. And the chin is not touching to the breast and the nose is touching the breast. So this is showing poor latch. So how do we get a proper latch or a deep latch? First, we need to take the baby in the proper position. Try to aim the mother's nipple towards the baby's nose and not towards the baby's mouth. And when you, after aiming the nipple towards the baby's nose, try to stimulate the upper lip. This elicits the rooting reflex and baby tries to open mouth with a wide opening of mouth. At this time, try to tuck the chin towards the lower part of breast and aim for a wide latch. So aiming for a wide mouth is the most important thing. Only if the mouth is wide open, then the latch is going to be deep. And always aim for a asymmetric latch. So more of the breast tissue from the bottom of the areola than the top. And the angle should be 140 degrees for a wider mouth. And always focus on the lower lip during the latch. So sometimes the mother's breast can be big and the baby's mouth can be small. So there can be discrepancies. Just like when you want to eat a burger, you try to hold it according to the size of the mouth. Similarly, you need to adjust the size of the breast, compress the breast tissue to match the baby's size of the mouth. So this is known as sandwich hold. You can either hold it in a U-shaped manner, V-shaped manner, C-shaped manner, or like a sandwich. Now let's discuss about the various forms of latch. So this is the cradle position. So whatever is the position, the basics of the positioning are the same. So baby should be at the level of the breast. Baby's entire head, neck and body should be supported well, and baby should be completely turned towards the mother. So in cradle position, which we commonly see everywhere, in this position, the head of the body is in the same side of the hand of the mother. So though this is the commonly seen position, it might not be comfortable for every mother. So cross cradle position is almost similar to the cradle position, except that mother holds the baby with the opposite hand. So for some mothers, this position is going to be very comfortable. Otherwise, the other principles of positioning is similar. So this is the football position. Here, the baby is held like a football or a rugby ball. From one end, the head is supported on the hand, and the body of the baby is towards the mother's side part. So this position is especially helpful if mother is having very large breast, and it's also helpful in a post-cesarean section mothers and mothers with large breasts. So this is the lying down position. Mother is just resting on the bed and baby is taken onto the mother. This position is also very helpful in the first initial days of the delivery, and it helps in reducing the pain and stress of mother. And since baby is not need to be held well, this actually works well for the baby. So this is a controversial side lying position where mother is lying side on the bed and baby is also lying side and feeding is done. This is also helpful in the initial few days when mother, and especially in post LSCS mothers, when feeding can be little difficult, but always see that the positioning is proper and baby is not like very drowsy and mother is also not very drowsy when feeding in this position. So this is the dancer's hold position. This position is helpful in a baby with hypotonia or like Down syndrome, etc. In this position, usually, this position is helpful if we need to support baby's chin and jaw. So what we do is usually the hand is held from the underside of the breast with the thumb on one end and the other fingers on the other end. So with that, the breast is supported, and then slowly the last finger and the thumb are released, and baby's chin and jaw is held from two ends with the little finger and the thumb. So this is thus helpful in babies with hypotonia and chin and jaw issues. So breastfeeding, though, is always advised, it might not be possible for all mothers. And in that case, it is important to sustain milk production by expression of milk. So what are the neonatal indications for mother's milk expression? If the baby is sick, premature, low birth weight baby, not able to feed well, babies in the NICU, there is difficulty in coordination of suckling, and baby who refuses breastfeeding, has tongue tie, cleft lip, and cleft palate. In these cases, it is important to express milk. And what are the maternal indications for milk expression? The mother is sick mother, there is engorgement, and baby is not able to relieve engorgement. Then we can use a pump, and it can also be used temporarily for inverted protractile nipple until baby learns feeding. It's also helpful in mothers with mastitis, fissure, sore nipple, and working mothers. So what after the milk is expressed, it needs to be stored at room temperature at 4 degrees. It will stay at 4 degrees for 4 to 6 hours. It stays in a refrigerator at 4 degrees centigrade for 1 day, 24 to 36 hours, and in a deep refrigerator if it is unpasteurized for 1 to 3 months, and if it is pasteurized for 3 to 6 months. So in spite of the breastfeeding, some babies might still require extra supplementation either by express breastfeeding or with formula feeds. So when do we do that? Especially when there is weight loss much more expected than the needed, or weight loss is more than 7 to 10%. When jaundice is in exchange range and baby is dehydrated. And in late preterm and premature babies, in low birth weight babies, in small for gestational age and IUGR babies, and babies born to mothers with IDM who are all more prone to hypoglycemia. So milk can be expressed either by manual or hand expression, which can be very useful and helpful in some mothers. But the best way to remove milk is obviously by feeding a baby. Breast pumps are also helpful in certain mothers because they can be a little less painful, less time consuming, and they also help in maintaining or increasing the milk production. helps in relieving breast engorgement, plug ducts, and also helpful in inverted nipples. So the various types of pumps are, there are manual pumps, there are battery operated pumps, and there are electric pumps. Let us discuss about some common breastfeeding problems in the initial few weeks. So the first one is inverted nipple. So whenever the nipple is inverted, first initially we need to try doing the uh, massaging the nipple, doing pumping, and if all that is not still working, we can use syringe suction method. And in syringe suction method, we need to cut one end of the syringe, then invert the nozzle towards the other end and try to uh, pull the trigger, pull the plunger. And this needs to be done every time before the feeds, at least 5 to 8 times a day. And also while feeding, we need to hold the nipple and areola and see that the entire nipple areola is inside the baby's mouth. So the other condition is sore nipple. Sore nipple is usually caused because of incorrect attachment, because of shallow latch. And even if frequent soap water is used to wash nipples before every feeding. And it can be secondary to the fungal infections. So treatment is to continue breastfeeding, correct the latch because that is the main reason for the sore nipples. And hand milk can be applied to the nipples, and we can use lanolin creams also. And in between the feeding, we need to expose the nipple to air. We can use anti-candida medications if there is suspicion of candida infection. So breast engorgement can be seen in from day 3 of life, especially if there is delayed feeding or if there is infrequent feeding, if the shallow is latch and breast is not completely emptied. And in these cases, it is important to give analgesics to mother because it can be very painful. Apply warm packs with hot water fermentation before the feeding and express the milk. So do not completely empty the breast because the more you empty, the more will be the milk production and it will be painful in a mother with engorgement. Post-feed ice or cold packs can be applied. And baby needs to be nursed frequently. The other issue is blocked ducts. So whenever there is a block in duct, the milk collects in the ducts, leaving a hard, painful lump, which is swollen. So in this case, what we need to do is we need to breastfeed again very frequently. So try to see different feeding positions, whatever might be comfortable to the mother. So that might help in ejection of the blocked duct. Also, we can apply warm compresses and use gentle massage before feeding and try to compress the part of the duct which is blocked. So mastitis is another problem which is seen in the initial few days because of the inflammation in the breast caused by infections and stagnation of the milk in the breast. So it is characterized by a red, sore, inflamed area on the breast. Mother can have other symptoms like fever and flu-like symptoms, headache, nausea. So to treat mastitis, again, feeding needs to be given frequently. Mother needs to get rest. Heat can be applied to the affected area. And analgesics and NSAIDs can be given. So if mastitis is not properly treated at this stage, it will lead to the formation of a breast abscess. And here again, we need to drain the abscess with incision and drainage, give antibiotics, give warm and cold compresses, and continue breastfeeding. So most of the mothers complain of not having enough milk. What are the causes of not enough milk? That is most important causes: not breastfeeding enough, not giving longer feeds, giving very short feeds and not completely emptying the breast. And if night feeds are also not given properly, then also there is not enough of milk production. And again, suckling position and engorgement, mastitis, all these can lead to decreased milk production. And if mother is not confident, she's very anxious that milk is not being produced, there is poor oxytocin reflex, which again does not help in milk ejection. So whenever a mother complains of not enough milk, first we need to train them, educate them that in the initial few days, the requirement of baby is also going to be very small. So day 1 baby is going to have the stomach size almost of the size of a cherry, and baby will require only 1 to 1.5 teaspoons of breast milk. On day 3, the stomach size is the size of a walnut and baby might be requiring up to 30 ml of milk. By the end of 1 week, the size of stomach is almost the size of an apricot and baby will require 40 to 60 ml of milk. By the end of 1 month, the stomach size is almost the size of an egg, and at this stage, baby might be requiring around 100 ml of milk. So in spite of the education, if still milk production is not good, how do we improve the milk? So education both prenatally, postnatally is very, very vital. If the mother has a low birth weight baby or a premature baby, KMC can help in milk production and non-nutritive suckling can help in milk production. Also, mother's nutrition is very, very important. She needs to take at least 4 to 6 feeds per day, 2 extra meals, 550 to 600 extra calories, and adequate diet with proper proteins and fats. So, and early initiation of breastfeeding within the first 1 hour of life and giving frequent feedings, at least 8 to 10 feeds per day, and emptying the breast is very, very important for increasing milk production. While some galactogogues and herbals may also play a role in increasing milk production. And how do we understand about the adequacy of feeding? So your baby is happy and relaxed with relaxed fish after feeds. There is good weight gain, at least 20 to 30 grams per day, or at least 500 grams per 1 month. The pee count is good with at least 6 to 8 urine episodes per day. And if the breast becomes soft after feed, all these indicate that the feeding is adequate. And then we need to ensure that the mother's milk production is adequate. Okay, so this completes my session. I would like to end with this quote by Pamela Wiggins. Breastfeeding is a mother's gift to herself, her baby, and the earth. Thank you.